Well, if you started to notice the signs and symptoms of what you might think is varicose veins, go ahead and make an appointment to see a specialist. When left untreated, varicose veins can create bigger problems that are often difficult to treat. Here to explain is one of the vascular surgeons from the Vein Center, Dr. Stanley Snyder. Dr. Snyder, welcome back to the show this morning.
Thank you very much.
All right, so we're talking about the consequences of leaving those varicose veins untreated. As we said, they can create bigger problems. Talk more about what could happen if they're neglected.
Well, initially it's a discomfort that people have, and then they start to see some bulging in the veins. It's all from the reflux we've talked about before, pressure that's being transmitted through incompetent valves from up in the abdomen down into the leg. So if those valves aren't working, the pressure's got to go somewhere.
Okay.
So the first thing you have is, again, some discomfort, maybe some swelling.
Right.
Following that, then you start having problems with bulging veins, and usually they'll begin to, the calf is where they'll start out. They can be other places, but most of the time they'll be in the calf. If things are left untreated over time, then you start getting blood cells that actually go outside of the veins, and you start getting a pigmentation down in the calf. You've probably seen people with the brown spots or brownish discoloration, and it physically tattoos you. Once you get that pigment in the skin, not much we can do about that.
Which is why it's important to get treated early.
Right, and if you, in extreme cases, and not really all that uncommon, if you continue to have the problem untreated, you start getting unhealthy skin here, a small nick or something turns into an ulcer that won't heal. Even if you've got good arterial circulation, it can't get to this damaged skin in the area of pigmentation. You start getting ulcers.
Now, the pictures we were seeing, a lot are in that phase where they're starting to bulge. Usually, how long does it take to get there?
It's totally different in every patient. I mean, some people might just have the bulges, and most people would have the bulges their whole life without going on to certainly the ulceration stage.
Okay.
But it's not that uncommon. We see people almost every week who have some ulcers.
Now, let's talk more about the symptoms and when somebody should be concerned. What should they know?
It's a little hard early on to know what it is. Everybody's legs get a little tired after you stand up for a while, and a lot of people have some swelling in their legs, particularly as you get older, and if you've got a job where you've been standing up for 20, 30 years, it's not uncommon for your legs to be tired or heavy. Certainly if you start getting bulging veins, then you know for sure that's what's happening. Edema, swelling in the legs, most of the time is not just from veins. Usually that's multifactorial. It's something other than varicose veins. But if you start getting the bulges, especially in the calf, along with discomfort, heaviness, tiredness, goes away in the morning, then that's probably the early symptoms that you're beginning to have trouble with reflux in the varicose veins.
Okay, so folks who are starting to have that, or maybe they've already gotten to the bulging phase or even worse, why should they come to the Vein Center to get help?
Well, they should come because we're experienced at it. You know, we've done over 6,000 cases. I mean, we're all board certified vascular surgeons. We can not only treat that problem, but can identify whether that is the real issue, or if there are other issues, we can help diagnose those also. And sometimes even people who have this discomfort of legs turn out to have an arterial problem when they thought it was the veins all along. So we can give the full spectrum of diagnosis, which is really the important part, and treatment.
Right, and of course it's important to get help from a registered vascular technologist or an accredited iCaval location. Talk about why that's so important.
Well, it's the test to see for the valvular incompetence. I mean, if you halfway do the test, you get a halfway result. So you need people who are accredited, who've been doing this, who do it a lot, who've had the proper training for it, because the treatment is to ablate the veins, or to close them down. If you make an incorrect diagnosis and close a vein that doesn't need to be closed, well, that's not a good thing. Or conversely, you could miss it and say that they didn't have it when they really did. But having the key to the whole thing is having the correct non-invasive diagnosis. You can tell most of the time by physical exam if people have it, but the non-invasive lab is where it's really key, and so the better the person doing the test, the better result.
Makes sense. And you have a special offer for folks watching today in case they're experiencing these signs and symptoms. So this is a complimentary evaluation or a second opinion for the first 10 callers. The number to call is right there on your screen, 615-269-9007. Again, that's for the first 10 callers right now. They'll receive a complimentary evaluation or a second opinion. Dr. Snyder, thanks so much.
Thank you.
Hey, the Vein Center has 2 locations, one in Belle Meade at 615-269-9007 and another in Cool Springs, that's at 615-503-9895. You can also find more information on their website. There's a link on the More at Midday section of WSMV.com.